thank you all for joining us this morning. For those of you that don't know me, and I see there's quite a few people that have logged on for the first time, and I want to just invite you to go ahead and understand that this is an interactive webinar, that there's a chat room. As you can see, there are people typing in, and that any questions that you may have, any comments that you may have, any input, it is welcome. We just want to let you know that we're here for you from Bion Research and Skincare. Myself as the Director of Education. My name is Cheryl Matthews, if you don't know. And what I want to do today is just kind of give you a little bit of an intro to microneedling. There is a lot of buzz around the whole topic. There's a lot of misinformation. And for my background previous to being an esthetician and in the skincare field, I came from a law background. And so it is very important to me that as I go through, especially things that are of this level of importance, that I'm giving really good information, good sound information, and I try to keep information and myself current on things. So what I want to do right now is to just get started. I see that there are a lot of people in the room, so that's really good. I'm excited about that. Again, my name is Cheryl Matthews. I am a licensed esthetician. I am a makeup artist, and I am a global educator. I have been in the industry around 30 years. I am a master reflexologist. I do body treatments. I've owned and operated a salon and spa. So I come from a background very similar to a lot of you. I have not worked in a medical environment, but I have done my research. I know a lot of people that do, and I keep up with what's happening within the industry. Microneedling is, as I say, it's the buzz topic right now. When we go to the shows, when you're looking at information, I took a look at even what's happening with YouTube, and there were some really scary things going on out there. So I want to get started and go ahead and give you some background, some information. And as I say, I welcome your input. So we have an agenda. The agenda is what is microneedling. We do have information on the objective of what microneedling is, a little bit about the history, the benefits of microneedling, and then I want to give you a little bit about Bion's story. As I always say, and for those of you who don't know, I believe education is everything. So class is now in session. What is microneedling? Simply put, microneedling, derm rolling, you might hear percutaneous collagen induction or collagen induction therapy. That involves the use of manually applied skin rollers that have around 200 fine surgical needles. There's little needles that are attached to the rollers. I'm going to show that to you. And that is on a roller mechanism. It is applied directly to the skin in a cross pattern, as you can see there, and the multiplication symbol. So you'll have a crosshatch, so you're making sure that you're covering all of the area that you're rolling. The objective of microneedling is to stimulate or puncture the skin to stimulate collagen and elastin production. It helps to smooth the skin. It promotes scar or stretch mark healing or reduction. And it facilitates the skin's natural wound healing process in the mid dermis. I almost liken it to I can't even tell you right now. I'll come up with the word. But the benefits of microneedling, if you can see here in this picture, microneedling penetrates the skin and induces the production or introduces the production of collagen, your body's own collagen production in the dermal layers. So what it does is, if you're looking at this photo, you can see that for those of you that are listening in, these slides and everything will be available on YouTube, so don't worry. But when you're looking at the surface of the skin, you can see there that the collagen is here in this level, in your dermis level. After micro rolling or microneedling or derm rolling, you can see that the collagen production has increased dramatically. And that was just a good graphic for that procedure. For a lot of times, you want to understand and know the history of something. If you understand the history, then you realize whether it's a new something that's just a little buzz or whether there's actually science behind it. Microneedling is not new. The evolution of the skin needling for its use today began in the early 20th century, around 1905, with Dr. Kromayer. And what he did we'll go into a little bit, but there used to be a lot of skin abrasion techniques that were taking place, and a lot of the techniques that we're speaking of started in Europe and in other countries. It wasn't until later in the 60s or so that the United States started to get a little bit more involved, and they got really more involved in the 90s. In 2004, Clinical Resolution Laboratory reinvented and released its first generation of the MTS roller, which is the roller that we use. As you see here, Dr. Kromayer in 1905. In 1953, you had Dr. Curtin. 1953, Dr. Philippe Simonin. 1995, we had Dr. Orentright, and he was very important with the subcision type of technology. Dr. Andre Camarand came around in 1996, very important to us. Dr. Des Fernandez really started the process of microneedling being what it is today. And then Clinical Resolution, as you can see, jumped in 2004 with their research and reintroduction of what Dr. Fernandez had done. And then we came up with our microneedling therapy system that we use here at Bion. Some of the tools, I just kind of wanted to go through and give you an idea. We say that it is an old therapy, and as you can see here, a lot of the therapy was done with the use of a tattooing type device, which is very similar to what is pictured here. Another is a stamp, a skin stamp, which you can see it's a little tube, and it almost looks like a what we would call a little candle. But in that candle or in that body, you can see here that there's lots of little pins or little needles, and those would be stamped into the skin instead of the rolling effect that is now done today. I also went through and tried to pull some information because of a lot of the debriding and different things that were being done with the skin, and a lot of what was done with what we now use for pedicures. So as far as like the scrubbing or the sanding of the face, there's the we use this a lot of times when you're trying to remove a lot of dead skin. So you can see here that through the ages and from early time, this has been a concern for people within the skincare field. Fortunately, it was a lot of the doctors that were doing a lot of these things. It was not done by lay people. But the whole process and the ideology behind skin resurfacing actually started back probably pre-Egyptian times. It is attributed to during that time because of the use of some of the muds and the different items all the way up through today with our microdermabrasion type scrubs for exfoliation. So brightening, lightening, reintroducing new skin has always been a topic of conversation within the dermatology field. Give a little bit about the early beginnings. In 1905, the German dermatologist Ernst Franz Ludwig Kromayer published a report in 1905 describing the use of a motor-driven circular knives to gradually remove the layers of skin. Sounds very invasive, doesn't it? And later he introduced an improved practice of using rotating burrs. I'm going to show you a picture of that, powered through a dental drill. So they were very, very creative with trying to come up with systems that could be utilized in their treatments. But through his experiments, he concluded that the secret to scarless healing was to leave the deeper reticular layer of dermis untouched. And so that became the basis of the microderming and the derma rolling and the systems that you know of today. This is an early drawing of Dr. Curtin's the abrasion techniques. I was watching my camera there. In the United States, the abrasion became popular after Iverson in 1947 introduced a sandpaper technique. Again, like I said, later, Dr. Curtin revived and popularized what Kromeyer, we talked about Dr. Kromeyer, his techniques of using the rotating machinery to produce what Curtin described as corrective surgical planing of the skin. And if you look at this drawing, I don't know if it's large enough, but you can kind of see that there's all these little brushes, very, very, almost like a hand drill, and the brushes would go onto the surface here and they rotated. And that's what was used in order to facilitate this dermaplaning or this surgical planing of the skin. Popular skin resurfacing techniques. We talked a little bit about that, but we'll just do a little bit of review here, where we talked about the dermabrasion and the chemical peels, which are ablative, and by ablative, it almost is what the word says. It obliterates or removes that layer of skin. So with the dermochemical peels, that was their purpose, was to remove the top layer of the skin. If you ever notice when you do a peel or you've had a peel, the skin looks new, it looks revived, it looks very smooth. A lot of the fine lines and wrinkles are gone. Laser skin resurfacing with the CO2, the Fraxel, also ablative. It is, the technique of it is to vaporize those top skin layers. So those are two techniques. Microdermabrasion, which I'm sure a lot of you are very familiar with. It is a milder peeling procedure, but it too is ablative because, again, you are removing that top layer of skin. Then you have your thermage, your Sonolift, which are called non-ablative, and that is because they use a radio frequency or ultrasound high energy to change the large tissue area, but there's no epidural injury with that technique. The IPL or photo regeneration, also non-ablative, and that's where the broad spectrum light influences the texture and the pigmentation. So a lot of times you'll hear that they're using IPL or photo regeneration to remove pigmentation on skin or skin that has been very, very damaged. Then we have our MTS roller, which is the roller that we use, and that's the one I'll speak on. Non-ablative, it uses the needles to induce the body to produce collagen and elastin. So what it is those needles go in and they encourage the collagen and the elastin production. And there'll be a little bit more information in that. Right now, I'm going to let you know a little bit about what that advanced needle device that MTS created is about. After they did research and they reached back into that information, very similar to the story and the information that I've given you. And what they did was they decided that they wanted to develop a roller. So what they did was they reinvented and designed a new pattern for the device that you saw with the burrs on it. And they released that instrument to the public in 2004. The one that you see here in blue is the prototype, and the one that you see below with the case is actually the MTS needle that is available to you today. It is available to clients, it is available to estheticians, and it is available to physicians. And we'll go in a little bit about who can use what. And a lot of that will be based upon where you live. Did you know that only minor fractions, and they say at most 0.3% of the active substances or the ingredients in those creams, those gels, those lotions that we utilize can actually penetrate the surface of the skin? The purpose and the reason for that is because, especially if you're using a collagen production or a collagen cream, that is saying there is collagen in it, the collagen molecules are too large to actually penetrate the surface of the skin. So these active ingredients and these substances don't penetrate deeply enough to be very effective because your skin is actually designed to protect it from external environment. It's like when we step into a bath or a shower, we don't drown because the water is not able to penetrate the surface of our skin. But research has proven that when products are used with microneedling, the effectiveness of these substances are enhanced by up to 40%. Can you imagine just how amazing a treatment like that would be able to give you as far as results? I wanted to give you just a little bit of an idea of how this actually works. Generally, we have the traditional application of our topical ingredients that would go on the skin. If we look at the surface of the skin on the stratum corneum or the epidermis, you can see that the UV rays, the toxins, all the different things that damage our skin. If you look at what happens with the microneedling, the channels are created with those little needles, and those channels are actually serving as conduits. They actually are almost like little tubes that allow whatever you're placing on that skin after a microneedling session to go deeper into the layer of the skin. Goes right through, penetrates those channels through the epidermis. And with that happening, natural or normal conventional cosmetics are only going to target the surface. And when I talked about, I have another class that I do on adult acne, and I talk about us treating a lot of times what I call the dead zone, because as you look at how skin progresses, you see the cells come up from the bottom, and as they get to the top, they lose a lot of all the nutrients and everything, the collagen, elastin, and when it gets to the very surface of the skin, it actually sloughs off. That's where we exfoliate and do the things that we do, and I call that the dead zone, because those are just dead skin cells that need to be removed. After the treatment, you can see here those channels, those active ingredients are able to go down, and a lot of times infiltrate into the deeper layers of the skin. We know here that at that point, 0.3%, you get an effective result with what we do without microneedling, because a lot of times after you do a facial, you can see the difference. But if you're utilizing microneedling, you would be amazed to see how much of that natural DNA starts to regenerate and promote more collagen and more elastin production. The moisture absorption percentages, you can see here, as we said, with a regular moisturizer, 0.03 to maybe up to 1%. With the liposome, and a liposome is a almost like a little bubble, and inside the bubble would be whatever the therapy, the treatment, maybe collagen for people with cancer, the cancer ingredient or potion, if you will, is put inside, and that is allowed to go into the layers of the skin. And that's how that would go. With dermabrasion, you see 3 to 20%, but with the roller, MTS particularly, because again, that's what I'm speaking on, you get 75 to 85% absorbency. That's up 3,000% from what a normal moisturizer placed surface topically on the skin would do. For MTS conditions and treatment options, I wanted to do a little chart here, and I really wanted to do this to get everyone to understand. I don't even have 0.3 on here, which is the roller that would be allowed for your client to take home and use for home care. A 0.5, which is what we as estheticians, unless you're a nurse or a doctor or in the medical field, you would only be allowed to use. I know here in California, we can only use a 0.5. For cell regeneration, excellent. The upper derma, reborn, as they say, excellent. Anti-aging, anti-wrinkling. Light scars, pimples, blemishes, excellent for after acne has been abated. Deep scars, pores, refinement, you see that jumps over into the one millimeter needle, and these are all needle sizes in case I didn't make that clear. To enhance nutrient production, again, you can see that with the 0.5, that does happen. For cellulite and stretch mark treatments, unfortunately, it has to be a 1 or something above. Hair regrowth, which is something that I think a lot of people don't realize you're able to do with the microneedling treatment. is hair regrowth. You can roll and put the substances in, and that will facilitate the growth of hair. Also for eye treatments, you just want to be extremely careful and make sure that the size of the needle is used correctly around the eye area. But I did show here that for 1.0 all the way up to 2.5, those needles are for doctors only. And there's a reason for that. And as I was doing a lot of research and checking needle sizes and different things like that, I did see that there are websites that allow people to simply order, and they can order what they want. And it's very dangerous, because what I saw being done with some of the needles that were being ordered was a little disheartening and a little scary. And that is why we have to be so very careful about the information that we're passing on and the information that we ourselves gather. Again, 0.5 is the size that we generally will handle, unless you have another certification or licensing, which it'll allow you to go to the 1 all the way up. But as you can see, I have, again, cell regeneration at the deeper levels, derma, all the different things, the anti-aging and wrinkling, scars, all of those things can be done, but they're done at a level which are done through a physician's office. A little bit more clinical view, I just wanted to kind of go over again how this really works, and how this system, you can see here that the needles go in and the channels that it creates. You can see the fibroblasts are stimulated, the reaction of the cell membrane starts. In picture number 3, you see that the skin resistance decreases. So the skin starts to really accept what is happening. The skin has been injured, but immediately it starts to go to work to protect itself. And that's the premise of what microneedling is. And then you'll see here that in number 4, with the fast healing, those little needles are so very fine that the puncture that they create allows the skin to heal quickly. And they say within an hour that the puncture that has been created closes itself up. So that's why once you do the rolling, you put your product on, you can see at that point in time, the skin starts to heal. Now, granted, you will see redness. You will see redness on the skin. You'll see a little bit of irritation. And depending on how deep a roller you use, you might have to use a numbing cream. But the effect of it, once you get that phase of collagen and elastin to being produced, you'll see a definite result. The healing period is very quick. It goes back to what we were saying. Those holes start to clear up and close themselves up within an hour. Now, for that redness that has appeared, usually within a day, sometimes 2 days, depending on, again, how deep you've gone in. As compared with dermabrasion, 2 to 5 days. So, you'll have that redness, that irritation, and that peeling that will start within that week. With laser treatments, 30 to 60 days. So you've got 60 days for the skin to repair itself. So if you look at the healing time, you'll get a lot quicker result and a lot better recuperative time utilizing a roller. The benefits of the MTS and Bion to clients. I think that some of the tips and things that we need to remember and be able to share with our clients is that it is non-invasive. They say it is natural because of the fact that it isn't a ablative type treatment. There's no known negative side effects. And that, again, provides that you're buying a needle and a roller that is of high quality. You don't want to order something simply because it's cheap, or use something that is not going to be made to really do what you want it to do at the highest level. Again, you're doing something that is questionable to your clients. I mean, anytime you go to anyone with needles, people raise an eyebrow. So you want to make sure that you're not using a roller that is so inexpensive that sometimes the needles come out, and that can be quite scary if those are going to have to be removed. I have seen people utilize needles that were too long, and instead of knowing how to do the procedure, I watched them roll and roll and roll and roll. And one young lady rolled her face for 10 minutes. it should take a couple minutes to do a full face. There is no damage to the skin. The home client needles are 0.3, estheticians 0.5. Can be used on all ethnicities, and I say use caution here because a lot of times when you won't see that redness on a person of color, or maybe what you determine to be no problem is actually causing an issue. So you want to be careful. And again, it goes to utilizing the correct needle sizes and being very, very mindful to watch and see what the progress is. It can be used on all faces of the area of the face, the neck, and the body. You really don't want to use it on the eyelids or the lips. They do make now different sizes of rollers, and there are rollers with lights on them, LED lights. There were a lot of different options out there. Again, one of the benefits is that rapid healing time. And again, we have long-lasting results. That is probably one of the most important things, is that especially if you're doing this as a service to your clients, you're not going to roll their faces every day. You can utilize the 0.3 needle at home and do it maybe 5 times a week. For an esthetician, you're going to see that client every 4 to 6 weeks. And it is affordable compared to laser and chemical peels. So that makes it probably one of the most enticing benefits, along with what it does, is the fact the treatments are very affordable to your clients, which means that you can get them to come to you. They will get their needle. What I would do if I was serving a client with this treatment is I would have them to purchase their needle, and their needle that I used on them would be kept in my facility. I would not allow them to take a 0.5 needle home. Clients have a tendency to think more is more. I would keep it in my facility, and when they come for their treatments, I would use it. That needle, their needle personally would last them probably 6 to 9 months, depending on how many treatments that you do. And then for the home care client, they can take a 0.3 and they can use that at home, and they can get a very, very nice result. Within a couple weeks, they will definitely notice a change in the texture and tone of their skin. Those wrinkles and lines will start to soften. And I always point to mine. I should stop doing that. But it is one of those things that you will see a reaction, and it will be long term. Is there a risk of infection? Constance asked. One of the things that you want to make sure of, Constance, and if I have time, I'll go ahead and show you a demo that we have, is that you want to make sure that the face is clean and that any and all items that you're using on the skin have not been misused or bacteria introduced. So as far as your cleanse, you want to make sure that skin is clean. If there's any question about that, you can hit me up on an email. But you're also making sure that your derm roller, it will be cleaned each and every time they use theirs, or when you use yours. You will clean it and you will dry it, and you will put it away. So then you do reduce that risk of infection. And as I say, when I say clean it, that means with disinfectant, which is what we use for our instruments. For home care, you would suggest the same thing for your client so that they're not introducing bacteria. That's why I say it isn't one of those types of things that everybody should be doing, because clients really, really aren't as responsible as they would seem to be. And even at shows, I've had estheticians, or who we would perceive to be estheticians, to come up, and the stories that they tell, the things that they do. I had one lady explaining to me that she didn't understand why her client was rolling her face, and she rolled her face and she rolled her face. She did it every day, and when she came in for treatments, she would roll her face until it bled, and then she would stop and let her rest, and then she would do a chemical peel on top of it. So we have to be very, very responsible with what it is we do. Heidi's asking a question about the presence of dead skin cells on the needles. Heidi, I'm not sure whether you mean once we're finished or while we're rolling. So maybe you can clarify that for me. As far as while you're rolling, yes, how we clean them. Okay, the derma roller. You will clean it again. I'll give you a little demo, but you can clean it with your bactericide. We have a kit that I'll show you at the end that has a pad on it where the cleaner has been put on there, and you roll in order to clean. And then again, for those of us with the bactericide and the sterilizers, that would be definitely an option for what you would do. As far as dead skin cells on the surface of the skin, the needles are simply puncturing. And in that channel, I don't believe that those dead skin cells are traveling down into that chamber. I think that it is just simply a puncture, kind of like aerating grass, or when you see on a golf course, the golfers have the shoes with the spikes and they just walk and it just punches holes into the ground. Very similar what happens with our rolling. So hopefully I answered that question for you, Heidi. If not, hit me back and I'll reiterate a little further. Want to give you a little information on how Bion got started, and I was very interested in this because it is one of those things that not everyone's going to jump on top of. And I asked Larry, and Larry gave me a little information, so I just called it a Bion story. And I say that it began around 3 years ago when Bion was asked to develop a product for a company working with physicians utilizing human stem cells. And those stem cells, for those of you of concern, were donated placentas. They were not stem cells that were taken from people. And they were mixed with the patient's own plasma rich protein to stimulate collagen production. Again, always looking to see what can be done to renew and regenerate our skin. 6 weeks later, Collagen Revival Serum, which we use today, was born. And I say that because after the meetings, the information and the exchange of information on what the product can do, what the ingredients needed to be, and what the need of the physicians were, they came up with this serum. Bion also developed a treatment regimen for both pre-treatment and post-care after the stem cell injection. So they were very involved in this whole process. It wasn't like they heard about it and they just decided to create something. It was actually a collagen revival serum which was created for the purpose of microneedling. And the story continues. Bion continues to distribute a leading USA manufactured brand of microneedle roller. That is the MTS roller we've been talking about, because we see that the benefit of quicker results when used with our collagen revival serum for collagen production. And that's very important. A lot of times people will purchase a needle and then they'll go to someone else, another booth or another vendor, and then they're buying a product that was told to them that was going to be very good because they can get a gallon of hyaluronic acid, which for our purposes, we should know that hyaluronic acid is, I think it is 1,000 times heavier than water. So you need that. The skin needs that. It will draw that into the skin. But you need other things in order to help stimulate. And you want to make sure that since you are doing something a little more invasive, you want to make sure that you're using the best product available to use on your client. Then you would get an optimum result, but you also will know that you've taken care in not introducing anything that would be a bacterial or infective presence. You want to make sure always that you're using your best. We see that the benefit of scar resolution, especially for acne patients, which Bion is known for its acne products, that after they have controlled their acne, that with the derm rolling, a lot of that scarring clears up and that the clients can see a resurfacing of their skin. And then when used with Bion's BioReplenish ACE, microneedling will help with sun and environmental damaged skin. So skin that is, I'm trying to check that chat room, skin that is damaged from the sun, or a lot of times in the chart that I showed you, a lot of times with burn victims or people whose skin has been damaged in that way. The BioReplenish ACE, and I won't say for burn victims specifically, but microneedling is used to help, again, to create the body, to create healing. And so products matter. Our collagen revival system, these are some of the ingredients. We do have the aloe. We talked about liposomes, and that is that little bubble. And inside you'll see that vitamin A, C, and E. Sodium hyaluronate, I'm trying to check Heidi here. Calcium hyaluronate, calcium, magnesium, and zinc. And then our green tea extract. All of these items are very, very healing and beneficial to the skin. And in the word collagen is here, but you see there is no collagen in it. It is part of a collagen revival system. And Heidi's question is, if estheticians can only use 0.5, can we assume we are only penetrating the epidermis? Therefore, no. Therefore, how is collagen stimulated and produced? Is it the action of the roller, or is it simply creating a channel for increased penetration of a product to increase collagen? At 0.5, we are actually able to create a channel, and I can go back, Heidi, if I need to. Go back a couple slides so that you can see that at that level, we're going down. Okay, not this one. There we go. You can see here that you going down into it, just tips, the tips of the needles are just reaching into the basal layer, not quite into the dermis. We call it that mid-dermis area, where the channels are introducing the product, and the product itself and the injury are what caused the collagen and elastin to be increased. It's not because of the product that is being put into the needle. It is actually the injury the needle causes on the surface of the skin into the deeper layer, and the body is responding. So it's almost like when you get a cut, and immediately when you get a cut, the skin, the body starts to try to heal it. It tries to close that area up. Same thing happens with the microneedling, and I hope that makes more sense. It's a very, like I said, it's not a new technology, but it is new as far as what is being utilized within the, you're welcome, Heidi, within the industry. And we want to make sure that as we go along, that we're not just doing things simply because it's new, it's a buzz, our clients are all excited. We want to make sure that we have background, that we have information, that we have training, and you want to make sure. 0.05 is the Bion protocol. And at that point, there should be no blood. You might get a little pinpoint bleeding, but that is probably the most that you should get. You should not have blood oozing as you would if you were in a physician's office where you're rolling a lot deeper and that blood is actually coming up. You want to make sure that, again, pressure, you know, you don't want to roll a face like you're rolling cookies, you know. I mean, these are some of the challenges that I personally have with just handing needles out to people without training. Oh, sorry about that. I'll go back one. I wanted to talk about the BioReplenish a little bit, and that's our sun damage repair cream. Vitamin A, C, and E. Again, the turmeric, the ferulic acid, the calcium lactate, your green tea extract, all of these things, very healing, very, very healing to the skin, helping with the tone, helping to lighten, to brighten, and to protect that skin. We do have a roller video. I was trying to upload it for you. I don't know if, in fact, I can do it again. I tried. I'm not sure that it's there, but we can see. Nope, it's not there. It's not there. It kind of showed a visual, and it goes through and shows the steps of the microneedling facial, but you can go on our website and look under our microneedling and under our education, and there is a video that goes through the technique itself, the rolling, the facial, and it's very short. It only takes about 3 minutes. So again, as I say, the young lady that rolled her face for 10 minutes, I was horrified, but she did it. And as I say, I watched several people doing the treatment on themselves. And a lot of times, you know, they just would roll their face and roll their face and roll their face. And then they'd kind of change the direction. But again, I really think when you're handling and doing these type of treatments, you really, really need to be trained. Bion does offer with their microneedling kit, there is a sanitation kit that is offered, and that does have your the cleaner here. You know, you see the roller. There is a little pad here that you put the cleaner on, and then you roll your cleaner to clean it. And again, I would still go ahead and use my my bactericide to clean it, or my sterilizer. And we also pair that with the Collagen Revival Serum. The recommended pricing on a microneedling facial, Heidi, it would depend on your area. I would do a little research to see. I can't make a recommendation because I have people from all over. I would just do a little research to find out what they're running and whether or not you can introduce that as a series to your clients. I think that would be a good way to promote it, is to, you know, offer it to them as a series, maybe 2 or 3, maybe 4 a year, and maybe package their home care roller with it, and and a product, and do it like that in order to facilitate. And you want to make sure that if you are going to offer it as a facial, you do before and after pictures, because honestly, from seeing something today to seeing something tomorrow to seeing something in 3 weeks, clients forget, you forget, and pictures are worth 1,000 words. See someone typing in there. Have a little bit of information about our home care. Can the treatments be used on any Fitzpatrick? Constance, I am being told, and I have not done it on everybody. I'm going to try doing it on a girlfriend of mine that has a lot of scarring on her skin. And so we are going to jump in and do it. But from what I understand, it is fine for all Fitzpatricks, all ethnicities. And in fact, I actually called the company MTS several months ago regarding the needling, and realizing and knowing that a lot of the microneedle companies are Asian based, and those communities are very, very conscious and concerned about melanin production. I can't believe that they would create an item like this that they've utilized that would create a melanin problem. And that's one of my questions. And I've questioned several authorities on that, and they guarantee me that any Fitzpatrick can use the needles. We do have a little protocol that goes with our home care, as we do with our facials, and that would be with our mineral cream exfoliating cleanser, using your collagen revival serum, line reducing complex, and your titanium dioxide sunscreen. And in the evening, very similar, your exfoliant cleanser, your exfoliating cleanser, or a normal cleanser if you like. The BioReplenish ACE, the Collagen Revival. The ACE you're going to use when the microneedling is performed. Um, the Collagen Revival Serum, you apply and work that into the skin. Then you go ahead and also use your microneedling, and then you put on the calcium complex. Also, we have calcium capsules that I think would be phenomenal used after microneedling, particularly if you're going to send someone out during the day. Mix that with the titanium dioxide. It comes in a little capsule. You cut the capsule open, squeeze the contents in, and mix it with the sunscreen and apply that to the skin. Can this treatment, okay, I'm still keeping up. any further questions? Because I'm going to poll. I have a couple poll questions that I wanted to ask you all. And so I'll open that. And while you guys are looking at that, has this webinar been informative? I'm going to go ahead and continue to answer questions. Would you be interested in a hands-on advanced level class? And then we want to know whether or not you would like text reminders for our webinars, because that's something we're always trying to make sure that we're able to get information to our clients. So I was told by another company, not Bion, that their roller was FDA approved and it was okay for an esthetician in most states to use needles under 0.5, like you have also said. After researching more, I found that there are no microneedling devices approved by the FDA or cleared for use in the United States. It is also said that states can only use microneedles under 0.3 millimeters that don't make medical claims. How do we know this product by Bion is okay to use? I really want to offer this service, but I'm receiving a lot of conflicting information. Well, for one thing, I went through and you want to check. It's okay, Ashley. Good question. You want to check and make sure, number one, that as an esthetician, you are allowed to even offer this service. This is why I say information is power, and that education, you never stop learning. One of the things that I started checking into is who can use needles and who cannot use needles. But I couldn't go through all 50 states or all countries to determine whether or not you would be able to offer this service. Ashley, I don't know where you are. Number one, you'd have to go to your licensing board. That would be where I would start to make sure, just in case there are any regulations or laws regulating against the use of it. A lot of times within the board websites, they'll let you know whether or not there are any contraindications, whether there's any new laws. I try to keep up with those things for us here in California. As far as the roller being FDA approved, I can go back and double check that and get that information to you. I'm not sure. I'm thinking that because it is being offered and it is a U.S. company, it is FDA approved. I know that it has been approved as far as from the scientific codes and standards, because I did see that when I looked up their information. Let's see, and it has also said, sponsored by the FDA. I'm not, well, again, I'm not sure whether or not in the state where you are, you can only use a 0.3. If that is the case, then that is the case. As you can see, there are all the way up to 2.5s, which are being used within the medical profession. Again, we want to make sure that whatever we're using, whatever we're doing, we're going to go ahead and end this voting and go back to our presentation. Thank you guys for the information that you did in the poll. We just always want to make sure that we're working within the scope of what we do. I did a note here to all estheticians. I said, as professional skin therapists, we have a limitless choice of tools for our use, but it's critical that we understand how to use those tools safely, correctly, and appropriately. Understanding the boundaries of your state, license, certification, and scope of knowledge is mandatory. Knowing contraindications and risk involved is also part of the job to guide our clients successfully. Our reputation and our success depend on it, and that you never, ever stop learning. Again, I say class is always in session. There's never a thing that I think I know everything about. I'm always willing to learn. I'm always looking to learn. I see Larry's typing in the chat room there, so I'm going to wait to see what it is he's saying here, and I'm sure he's addressing the information. Oh, I'm sorry. And Denise put up a post in here saying protocol for esthetician in the clinic. Oops. We use Collagen Revival on skin during needling. Absolutely. What is the Texas protocol? No SPF. Um, it depends. I'm not sure what your protocol would be for Texas. Again, these are the things that I'm saying. You have to go back and check and make sure for each and every municipality that you're working within the scope. Um, uh, okay, Ashley's saying she can offer class 1 devices. Larry is saying Bion will provide protocols for your use, which we do. We have a booklet that shows protocols. The Collagen Revival Serum can be used prior to or after the rolling, and you must use SPF. Absolutely. Absolutely. I use SPF for everything. I don't care what it is. I think everybody should use SPF every day. I am sitting, and as you can see, there's sun coming from the window, the light from the window. I have on SPF. Again, that was another webinar that we did on sun damage. So I'm looking here. Denise is typing in the Texas treatment, and I'd be really interested. And welcome to all my girls from Texas. I just saw several of them a couple weeks ago at the Dallas show. So thank you all for joining us, and thank you all for joining us. But I'm giving them a special shout out because they were very, very receptive to me and very gracious to see me. Larry's typing here. Okay, so you can offer class 1 devices, which I can give you those categories and those classifications because they are available. Denise says, what about the ingredients in SPF? Is it okay to go into skin? Remember, Denise, that once you finish that rolling, very quickly, the skin closes itself up. Once you make that puncture, by the time you start to get to where you're putting on the SPF, the skin has already closed itself and the repair has started actually on the inside. So it works basically from the inside out. So you're not concerned. That was something that I questioned also, but once I understood the process and how the body worked, I was comfortable in making sure that SPF was applied to that skin, because you don't want that skin going out and being exposed. That redness and the irritation that you will see surfacely, you don't want that being exposed to sun. Larry is saying the FDA approves food and drugs. That's correct. I'm sorry, Larry, you are absolutely right. I know that, and not medical devices. So there is no FDA approved rollers or devices. The rollers and devices are approved for human use, but not legal in all states, which again, that goes back to what I was saying. Know the boundaries of your licenses, your certifications, and your scope of knowledge. Thank you for the reminder, Larry, because I know that drugs and food are only approved by the FDA, and that like I said, the medical devices have their own clarification and certifications, and I did see that on the devices that we're speaking of. So that's something that you want to make sure of. Again, you want to make sure that the needles are stainless steel. Ours are stainless steel, or I've seen them in titanium, and I don't know, I'm not familiar with those, but you want to make sure that the needles themselves are made of a product that is going to be very, very sanitary and very, very safe. And that they're in a case, or as you can see, the handle is made of a product, and the roller is made of a product, so those needles don't dislodge themselves and come out and embed themselves into the skin. Let's see. Larry says not all products can be used with rolling. Absolutely. You must check with your manufacturer to verify that the product is okay for intradermal, which is introducing it into the skin, use. Bion's titanium dioxide sunscreen and anti-aging products are approved for use with dermal rolling. And Denise says, okay, that's important for all of you to know. We do several webinars on our products. We do webinars on different treatments. We're always constantly trying to bring information, and unfortunately we can't bring it all into a webinar, but the questions kind of beg us to go ahead and make sure that the information that we're sharing, we're able to verify for you. And yes, so our products for our anti-aging have definitely been approved for use for intradermal use. And that's very important. Again, it goes to maybe purchasing a needle from us and then going and buying products because it was cheaper through another vendor or at a show or something like that. You want to make sure those products can be used intradermally. And these are part of the things that I say are our responsibility to our clients or to our clientele. And it matters, and it will reflect on your success, how informed you are as far as these different things. As I say, clients get access to information just like we do. They Google things, they YouTube things, they hear things, they read things, and they're constantly searching for a way to turn back that clock. And in doing so, it's our responsibility to make sure that as we guide them through these steps to repair their skin or to solve an acne problem or to reduce lines and wrinkles, that we're doing it at the best and top level of our ability. Again, we never stop learning. We never stop learning. I am here if you guys want to ask any more questions. I also do this little thing, and for those of you that are new, you don't know that when you jump on a webinar, you get something we call Buy on Bucks. That is a $5 card or discount towards the purchase of anything you want to purchase. Let's see. I have a hat here. The hat is full of all the names of all the people that were registered for today. Oh, I've got one that's not folded, so let me make sure it's folded. And what I'm going to do is I'm going to draw a name, and that person will win a gift pack, products that they can have sent to them. They'll be full size, and you can check out that derm rolling video, as I said, on our Bion Research page, which I'll give you that. And let's see, the person who wins is Kay Wilkerson. Kay, if you're still online with us, I need you to hit me in the chat room and let me know that you're still there. And she will win the prize pack. And if Kay is not with us, then we will reach in and grab another name. How about that? I want to thank you guys. I say that everyone in our industry rocks. I think you guys rock, you rule, and I just really appreciate you. I'm going to give you some information. We're going to see whether or not we get any feedback from Kay. You can contact me or anyone at Bion Research Skincare. My name is Cheryl Matthews at bionresearch.com. There's a phone number, 877-715-2466. I advise you to check out our website, not only for that derm rolling video, but we've got other videos, webinars, education, and where we're going to be as far as shows. I think that Kay is not with us, so let's grab another name, and hopefully it's one of the people that's still on. And let's see, we've got, let's see, Ashley Pettis. Ashley, are you still on with us? I sure hope so. I see Ashley typing. Ashley, you won. You won. So go ahead. If you don't mind, send me an email. I'm sure I've got your email address, and we'll go ahead and get that pack out to you. How about that? And if there's any other questions, I'm checking. Oh, you're welcome. I'm being thanks for my time. Thank you, Constance, for jumping in. And hopefully this won't be the last time that a lot of you that are new, we do have webinars probably about twice a month, sometimes 3. We do have one coming up on something for the fellows. We're going to talk about those ingrown hairs and some services that you can offer to them. Let's see, my mom purchased, oh, Ashley says her mom purchased some products at the Dallas show and she loved them. Yay! You appreciate the info. Thank you, Monica. I appreciate you, and it is always great to learn. It's one of my passions is teaching. So being able to share education, information, and knowledge, I am really, really excited about that. Also, we have something for the fellas, something for the brides coming up. And also, we're doing the global skincare webinar, and that one seemed to have been very, very popular. A lot of good information, things that people don't think about within the industry. So let's see. I don't know if you all have any more questions. I'm going to hang out for a minute. In the meantime, I appreciate you all. I thank you so very much. Again, my name is Cheryl Matthews, and it has been my pleasure to share this information and to have you join me. You can follow us on Facebook. You can check us out on Twitter. We are on YouTube. You are welcome, Heidi. Thank you for your questions. You can view our board and you can read our blog. We try to keep up with technology, sometimes a glitch or two, but we do our very best. Any questions, concerns, or even suggestions that you can offer us for us to do a better job in presenting information to you, or participating in what you're trying to do as far as your treatments, you let us know. We're here to help in that way. Okay, Patricia, I see you there. Thank you. You guys have been great. Again, hopefully I've been able to share information with you that either gives you the desire to go further with the microneedling or to think about offering it down the road as a viable arsenal, part of your arsenal for turning back the hands of time. That seems to be something that everyone is interested in. So if there's no more questions, comments, or anything popping up in the chat room, I thank you all. I know your time is valuable. Thank you for the survey. Thank you for your time and attention. And we'll see you next time. Thanks a lot. Bye-bye.